Hello, and welcome to today's episode of Got Transition Radio, which is brought to you by Got Transition, the National Center on Healthcare Transition, funded through a cooperative agreement with HRSA and the Maternal Child Health Bureau. As many of you may know, I am Mallory and I am the Youth Program Manager for Got Transition, and I am so glad to have my co-host with me, Eileen of Colorado. This monthly half-hour show is an interactive opportunity to join the conversation about transition topics and take away some lessons learned from people who are living it. This is our 10th radio show episode, and I can't believe that. We've definitely had some great conversations and learned and shared so much during these episodes together. It kind of feels like it's flown by. Eileen, isn't that crazy that this is our 10th episode?
Yeah, I was thinking about that while we were preparing this week, and I thought, man, last summer we were talking about, would we have enough content to talk about, and would we have interest? And it's been actually rather encouraging and surprising that the topics continue to be on a wait list of everything that we want to talk about and everything we've been asked to talk about. And also just the expertise that's out there and what we continue to hear from young people and from families about how important this is. So I was thinking about my favorite part of this journey on the radio show and what we call the radio show, this webinar. And really I think what it is realizing just how important this topic is and how much we continue to hear from communities, again, providers, families, young people, to keep it going, and that we really need to maintain this concept of awareness and being real about it, and to share what's truly happening in the trenches with young people and with families. So I agree with you, Mallory. It's been a wonderful time of planning, but also a wonderful time of understanding how much more we have to share. And I'm real excited to continue into our next 12 months as we move forward through the summer.
Yeah, it is kind of crazy to think how we started this not really knowing what it was going to turn out to be, and now feeling like we have our followers and introducing new people to it every month is always really exciting. So not only am I really excited that this is our 10th episode, but I'm also really excited because it's summer. And I don't know about where all of our listeners are right now, but with the exception of the past couple of days, the weather we've been having recently, that's pretty much all I've been able to think about is summer. So I figured, and I talked to Eileen and said, why don't we just talk about that on today's episode? So before we do, I want to just quickly go over the basic housekeeping items and how you guys can join the conversation during this episode. On the webinar panel on your screen, you will see a chat box and also a box that says questions. You can use either of these to type in your comments and your questions, and Eileen and I will respond to them throughout the episode. If you don't get to your question, don't worry, as we will respond and post all the questions on the Got Transition website after the show. So, when we think about summer, a lot of things tend to come to mind for most people, and at least for me. The beach, summer camp, being with friends, enjoying time off from school. But also for me, and for a lot of other young adults with special health care needs, those things often have a lot different meaning than they do for our peers who might not have such circumstances. And as I've said many, many times on the show, my journey in life has been a pretty incredible one. And I have always grown up finding a way to do things to make me feel included in the things that my friends were experiencing. But it wasn't always an easy journey for me or my family. For example, when I was 10 years old, I had learned about the idea of summer camp, and I really, really wanted to go and participate. However, when you have to get hooked up to an IV every night and can't necessarily swim in lakes because of the risk of infection, you can't always participate in the average summer camp. So we looked around, and even the camps that were advertised as being for kids with disabilities or chronic health conditions either had specific disease criteria, and now at this point in my life I'm used to not fitting into a quote-unquote category, or they just didn't feel comfortable taking such complex medical needs. So after my family made many unsuccessful inquiries with different camps and different programs, it was at this time when I was about 10 years old that I really started to have that moment of realizing I was different from my peers. And during that summer, I really started to get depressed and feel isolated and really question who I was and what I was dealing with. And this was when I was only 10 years old. So after some more investigation, we were really lucky to hear about a place called the Hole in the Wall Gang Camp, which was actually founded by actor Paul Newman. And it had a fully trained medical staff. And they took a very broad range of conditions, and it also happened to be free of charge, which was amazing. So this was definitely a huge step for me and my family, because this camp was in Connecticut and we lived in Maine. I had never even spent a night away, really. That wasn't just, down the road at a friend. So this was a huge chance that me and my family took, but it ended up being, one of the most amazing things in my life, and I learned so much and was able to kind of embrace who I was and what I had versus not being able to have those experiences. So, that's just one example, and I was really, really fortunate to end up going in that direction. Eileen, do you know about some other opportunities and how families might go about, getting their young person involved in something like that?
Well, first of all, I want to say that it was very brave of your parents and of you to go so far away out of state, and I think that that's a topic we could always talk about, is the process that parents go through in trusting and believing that everything will be okay. I also just wanted to talk about some of the things you brought up, and that was cost. Proximity to your home, the capacity for the staff to be comfortable with your condition. All of those things are points that parents and families and young people would need to consider. So it's almost like for my guidance for parents and families to talk with the young person is to really say, well, what are some of the drivers of our decision making? What are the things that we would negotiate on? What can we handle, whether it's, again, cost or distance away or access to communication? All of those things are really important factors onto whether or not this would be a fit. For us, for my family situation, our biggest concern is that, again, Holly's nonverbal and her level of independence is pretty low. She requires full care with all of her activities of daily living, so the bathing, medication management, the anticipatory guidance of whether her health condition, you can when you know Holly, and just like all of us, when you hang out with a person for a while, you know their cues. But in a camping situation, would the staff really be able to have that kind of anticipatory health guidance to know that maybe Holly's behaviors would not be typical, and is she acting in a way that would indicate that she's in pain or that she's going downhill? So those are some of the things that we've looked at. I will tell you that 2 years ago, and I think the last time that Holly went off to camp for a week, and it's a camp that she's been attending since she was about 14, so it's been about 8 years. And about 3 days prior to her departing, the camp director called and said that they had a staffing change, and that the person who was going to be assigned to Holly, the one that had been committed, was no longer available, and so they were assigning a new person to Holly. And they just wanted me to have a heads up, and I asked, is this person familiar with Holly? Have they ever met her? Do they understand nonverbal cues? Are they comfortable with her seizure disorder? And so suddenly I was kind of taken off guard. And I actually did not give the approval for Holly to go until I met this person and until I could feel comfortable that this person understood Holly's basic needs, and that I wanted to have like a mini training with them. So before Holly went off to camp, the aide that was going to be assigned to her made a special trip to my home and spent several hours with us, and I felt comfortable. I know Holly well enough to know whether or not she felt comfortable, and it turned out beautifully, and we had a happy ever after kind of story. But I just want to empower the parents out there to be proactive and to have your list of criteria of what is most important for you before you send your kiddo to camp. Even if it's a camp they've been to before, make sure that the staffing needs are okay. Know that summer camps almost always have a rotation of summer volunteers, college students and high school students, and to be sure to ask especially when you have a child who requires such high level of care, that as a parent that you feel comfortable with the staffing that is going to be happening during that week that they're gone. So I think it's really about preparation. I think it's about being aware of the healthcare needs and the caregiving needs, and what to do if there is an emergency. Will the staff be prepared? Regardless of whether you have been to that camp in the past, parents always feel that you have, and the young person always know that you have the right and the ability to ask for further clarification. So that's kind of been our journey just in the last couple of years, but Holly has attended the same camp, and I continue to ask the questions about staffing, and that's what's most important.
Yep. And for us, also, when we got there, my family and I spent a lot of time with the medical staff going over everything and, showing them the way we do things, and they were really receptive to that. So it really is about, having that preparation, and it was also a really big step for me to become more independent in my health, because I was aware of a lot of basic things, but I really had to learn the next level of my care to be able to instruct the medical staff in case there was a question. So, that week away during camp was a great example of how much planning and preparation really does go into something like that. And I think a lot of times we take for granted even things like, going on a day trip or, going to the beach. And for me, even just going swimming, whether it's in a pool, nearby my house or whatever, I also have to, make sure I have proper supplies for my dressing over my IV, and make sure it's a really clean environment. So it's not like I can just go to the river with my friends or, have someone throw me in the pool. We can't have that level of spontaneity necessarily. Also, when I was younger, we used to go camping a lot, and a long time ago, before technology had advanced, we would even use IV poles, and we would go to a campground and sit around our campfire with IV poles, and we always made sure that we were able to do things safely and, had a clean area for what we needed to do. But, to see the look on people's faces walking by, seeing us around a campfire with IV poles, people didn't always know what to think. But I think families of young adults with special health care needs, the effort to do things for recreation, it's never simple as just packing a picnic lunch. There's always things we have to be thinking about in terms of health and access. And so, I really commend everybody in the disability community who takes those steps just so their young person can be involved in the community and have those experiences.
Yeah, it's interesting you say that, because some of you guys have heard me comment that, we celebrate our inclusive communities and we celebrate the integration that we do, but oftentimes it's the community that's not prepared. And then that means that we, as those in the disability community, need to be the one that are being the teachers, and to give the support to the community members, or in this case camp staff, to help them feel most comfortable. I think that, you bring up such a good point that you guys were doing so much with your IV poles and cleaning your camp area so that you were assured that you didn't have any infections. But, it's pretty interesting it would be interesting to survey the other campers in that campground to say, were you surprised, and how do you feel now about inclusive campsites, which I think is cool. And I'm talking, it's so much bigger and broader than what most people consider accessible campsites. They're thinking, or accessible programs, they're thinking primarily mobility, accessibility with wheelchairs and walkers and that sort of thing. So I think that that's really interesting. With us right now with Holly, as I've shared with some of you guys, this is really, we're going into our 3rd year since she's been out of the public school system. So we're really adjusting and figuring out a lot of new schedule. And I recently, through a recommendation from another family member, which is how a lot of these things happen, through a recommendation from a family member, I received contact information for a group here in Colorado called Health and Independence Leisure Living, and they do day trips and week-long trips various times of the year. And that was another opportunity of transition for us to start looking at, is health and independence, is there enough there to support Holly's leisure living? And as you said, Mallory, with summertime, we often think about camps and campsites and camping. But for me, with Holly, I really just started with day trips. And as a matter of fact, today she's at a local water skiing event. And, Holly doesn't swim, and I don't know that she'll actually water ski, but she's with a group of her friends that she really enjoys hanging out with. And so we're doing day trips, and that is really an opportunity for us to test the capacity of the staff and also to see how Holly feels about the staff. And then there's another opportunity later this month for Holly to take a weekend trip to Cheyenne, Wyoming, to visit the big rodeo up there, and that's a weekend thing. So that would be the next level of her community, summertime, summer concerts, rodeo stuff. So that would be the next level. And then the third level, what we would look at would be taking advantage of the opportunity for a week-long trip, or, if they have a chance to do an actual camp issue. Then with this particular group, I would consider that based on this tiered approach of including her into their routine. So I think that that's again something with every staff member that I've met with this group that we're new to this year. I kind of do a pre-post, how did you feel, how did it go, and I do the same with Holly, and so that I can get a sense for her mood and her attitude before she leaves, and then also when she gets back. So I think that that's important, and would love to hear, Mallory, if you have any insights, or if anyone else out in the audience, if they have any experiences of what they've learned in this kind of testing it out and the capacity for a full inclusive opportunity.
We also had a question, Eileen. What camp program is Holly involved in? What's the name of it?
Holly has been involved in a couple of, one has been the Easter Seals Camp, and most of you guys are familiar with the Easter Seals organization, and their website has several sessions that a person can choose from. They have head injury, they have youth leadership, they have various sessions, so that's one. And then the other that Holly does is a Christian youth camp called Young Life, and again, that is a national organization. Young Life, and Colorado happens to be one of their destination sites, so people from all across the country come to Colorado for Young Life Camp. And with that one in particular, I started an inclusive program with Young Life here in Colorado, and that's fully integrated, but they also have a separate camp session at the end of the summer that all kids that have special health care needs, they have a special session so that there's increased capacity. So for any of you who are interested in those kind of national organizations, you can check out Easter Seals, and you can also check out Young Life, which again is a Christian youth camp, and they do have a national presence.
Great, thank you. And again, you know, if anybody wants to share of any other programs or opportunities that they're aware of, we would be more than happy to list those as well. So I think hearing your experience, Eileen, and the different levels of independence is really great. And I think with those various outings and day trips and different things, it's also a great time to learn basic skills about a young person's individual health and safety. Even, you know, summertime when young adults aren't going away. For example, when I was in school and it would start to get towards the end of the year when the weather would get really hot, I often had to know how to advocate for myself if I felt like I was getting dehydrated, because that was something that could happen to me in the summer, or really just not feeling well. And I really had to know my body and be able to talk about the symptoms I was feeling and what was happening, so that the nurse would listen and know when I needed to go home, versus, you know, me being someone who just didn't want to sit in a hot classroom like, you know, other kids might have done sometimes. So, you know, in thinking about that basic health and safety kind of stuff, you know, what are some things that you've done with your kids, whether Holly or, you know, your other children, during their summer activities to kind of enforce that?
Well, I am so glad you brought this up, because here we are. I'm joining you guys today from Colorado, and I'm looking out my window right now, and I'm telling you, our state is on fire. And the skies are gray and dark from the fires that are all around the Denver metro area. It is a scary situation. And so you bring up a good point about being prepared, but really, I mean, I hate to sound really public health-like here, but it really is about emergency preparedness. And I think about kids that may be up in camp right now, kids with and without special health care needs, and how are they evacuating them? And you know, did they have an exit plan? And Mallory, you and I have talked about this so much, about part of a young person's trajectory for success and independence is really being prepared, knowing their health situation, and knowing how to communicate that to others. And this is critical for all kids. So, you know, I've been thinking about it a lot, and I think about in the areas, there's an area just south of Denver in Colorado Springs where one of the largest fires is just sweeping, and it's going into a major tourist area. For those of you who know Colorado, it's in the Pikes Peak area, and Pikes Peak is one of the most visited mountain ranges in the country. They are swarming with people right now. And there are church camps and summer camps and adventure camps and river rafting, and all of those kids and young people have had to be evacuated just in the last 48 hours. And it frightens me. And I think about if Holly were at camp right now, would I have sent the appropriate emergency preparedness information? Would we have had a plan B? And I think that you know, we can't stress this enough. So in terms of, you know, what have I done in the past? For Holly, again, she has always had to have a one-on-one aid anytime well, she has it all the time, but especially when she's in a community or camp setting like that. So I think it's about kind of emergency phone numbers and contact information. But back to her health needs, what are the things that we might expect would happen? Similar to what you were talking about, Mallory, that, you know, Holly's seizures would increase with excessive heat and excessive fatigue. And so to be able to notice an elevation in her seizure activity based on these kinds of variables that would come in, I think, are really important. So I'm glad you brought up this this piece about being prepared and knowing what to do. But especially right now, guys, I'm sorry, I cannot stress enough as I look outside and see our smoke-filled skies. We really have to be prepared for I hate to say disaster relief, but that really is what it can be. And to just have that in mind when summer camp and camping activities are on the ticket for the summer.
And I think aside from that, there's so much more information about safety and wellness during the summer, because I think in the summer we do a lot more activities than we may, around the rest of the year, at least, in my experience. And when you live somewhere like Maine that has winters, there's a whole other kind of safety. But in summer, thinking about sun protection and swimming and making sure there's lifeguards and adult supervision and things like that. And on the slide on your screen, I actually found a great resource that the CDC has about summer health and safety, and it talks about everything from sun protection to grilling, which is also something we do a lot in the summer and may not even think about, but if it's not done properly, it can be really dangerous. So all of those things, it's a great tool to kind of look through and really think about when we are doing our summer recreation activities. So with that, we are almost finished for this episode, and I would just love to hear if anybody has any more questions or wants to share their own experiences with summer recreation or inclusion, or having difficulties finding opportunities for their young people to be included. We had a couple of things mentioned before the show about other state programs and opportunities, and I think one thing that's really great now is having the internet and being able to really search by condition or disability or area or interest, and I know there's so many things out there. Eileen, are you aware of anything else that you want to mention before we start wrapping up?
Yeah, I wanted to just, something just hit me while we were thinking about wrapping this up. I last week sent my son Michael, and I've shared some things with the audience about Michael in the past, so I just wanted to bring this up. He went to a football camp. He's starting high school this next year. And so it's a typical kind of training camp that football programs initiate in the summer for their athletes. And on the first full day of his training camp, he suffered a concussion. He's been slotted as the quarterback, and with it being the first real day and the first real scrimmage, the line didn't protect him, and somebody came in and just really pounded him. So he suffered a pretty significant sports concussion, and when I got the call from the coach, I went into resource mode, and I contacted, just as you mentioned, Mallory, the internet, and I went to, knowing that there is so much research on there with concussions, that I knew exactly what to ask the coach in terms of Michael's symptoms, the recovery, the protocol, making sure that they were not returning him to play, and I was able to work with the trainer, with the on-site medical staff, to get a quick assessment of how serious this was in terms of, do I need to come and get him? And so I think that part of the lesson learned here is really about, just to your point, accessing services right away, resources, and knowing that, again, in summer camp there's a lot of safety issues, but traumatic brain injury is almost always in the mix because of people falling and getting hurt. But to know that in terms of a resource, for parents to know that there are certain protocols on a lot of different injuries, but to just, again, once again, be prepared, be empowered, and know that there's always a support network to help you get through the injuries and the incidences that might happen while your kiddo is away at any kind of camp. Again, in this case, it was a sports camp. So thank you for asking for that. I forgot to mention that earlier when we were talking. He's doing okay. He actually has a follow-up appointment in an hour, so we'll be leaving here soon to go check that out. But I was very supported by a checklist that I found on sports concussion management, and that really helped me feel better as a mom to know that I was managing this camp injury very well. in partnership with his PCP, and that's who we'll be seeing in an hour is his PCP.
Wow. So we actually have a couple of comments from our listeners. One of them says, I was able to help our local Easter Seals day camp hire one of my son's caregivers as a CNA for the summer. She knows my son, and I know he is safe, and she knows him and how to deal with any problems. Advocating for our young adults is a huge deal. So that's really awesome that she was actually able to be involved in the hiring process of someone who is going to support her son in that experience.
Wow, that's, yeah, that is excellent. And that really speaks to a parent being proactive and knowing the capacity, the caregiving needs of what their kiddo would need to have a fully successful week at camp. And yeah, I think that's an incredible model to look at. And when you work with the right organizations like Easter Seals, who's, you know, again, their primary goal is to have a great camp experience for the people attending. So to work with the right staff to make sure that care needs are being met fully, that's fantastic. Thank you so much for sharing that.
And we have another comment of someone who says that they use respite services to provide a vacation for their daughter with a disability, and that lets them take their younger child for a vacation activity that might not have been enjoyable for the other sibling. So I think that's a really great suggestion too, is to look into those services that might be available.
Yeah, that's a good point. You know, I've often heard that's the secondary benefit, is not only does the young person with special health care needs have a week long to themselves, but the respite and the family support that it offers to the rest of the dynamics of the family is critical. And we need to always remember that supporting parents and supporting siblings is a key point to you know, successful navigation through disabilities and special health care needs. So I really appreciate bringing that up. We did that too with Holly. She would go to the Easter Seals camp, and just literally 10 miles away was a campground, and that's when our family would actually go camping. So Holly wouldn't be able to do a campground situation, so that's when our family got to do the camping experience while she was up the street up the road at the Easter Seals camp. So that's a great reminder. Thank you so much.
So unfortunately, we are just about out of time, and as I wrap up, I want to mention something really quick about where I'm actually going to be, not this coming week, but the next week. I am going to be working at a program that is a week-long retreat and does workshops around transition for young adults with genetic and metabolic health conditions, and it's called Face Forward. And during this, we are actually going to be doing a live broadcast that's going to be in a talk show format with all young adult participants and providers. And so they are going to be able to ask their questions to providers with different expertise and some older young adults who have had transition experience. And we're going to try to broadcast this much like we would a radio show. So more information will be coming about that on the Got Transition Facebook page, and as we kind of figure things out. But I really wanted to put that out to our Got Transition radio audience, because I think it's going to be a really groundbreaking kind of attempt with lots of experience being shared and really hearing some real thoughts from young adults. So if you're around on July 11th, I encourage you to maybe jump in here a little bit if you can. Otherwise, as always, I encourage you to find Got Transition on Facebook and on Twitter. You can find past episodes of Got Transition Radio as well as the resources from each episode under broadcasts, and now also on our Facebook page next to where it says Maps. So you can also download them from iTunes and register for our next episode, which is also going to be a follow-up from the Face Forward conference. We'll have a participant from that as a guest speaker and talking about what they learned in terms of advocacy and health awareness. So I think it will be really cool to have some more young adult input and really hear about what's on their mind and how they feel kind of in their advocacy progression. So I think we'll get ready to sign off. Eileen, do you have any last thoughts?
No, just everybody be safe and enjoy the summer and enjoy your family time, enjoy your friendship time, and this is a great time for families to come together and celebrate both as small families and large families, and keep health and wellness at the top of the agenda as always.
Great. Thanks so much to everyone for contributing and tuning in. With that, we'll sign off. Have a great month, and remember, every transition is unique, just like you.